fear NMDA receptor dependent long-term potential underline the molecular basis of learning and memory. Motor and control. Dopaminergic and cholinergic neurotransmitters are critical for motor control and condition. The dopaminergic pathway facilitates voluntary movement by modulating basal ganglia circuits. Acetylcholine acts at neuromuscular junction and within the CNS to regulate the muscle activation and motor learning. GABAergic inhibition within motor circuits prevents hyperexcitability and involuntary movement. Mood and motivation. Mood and emotion. Neurotransmitters such as serotonin, dopamine, and norepinephrine and GABA, they modulate mood and emotion, regulate serotonergic dysregulation in closely linked to depression and anxiety disorder, forming the basis for selective serotonin reuptake inhibitor SSRI treatment. Dopamine influence reward, motivation, and where norepinephrine mediates arousal and stress. Pain perception. They plays a critical role in pain perception. The modulation involves complex neurotransmitter interaction within the ascending and descending neural pathways. Endorphin, enkephalins, and dynorphin act at spinal cord substantial levels to exhibit nociceptive pain transmission. To transmit the pain, serotonergic and nonergic pathway descending from the brainstem enhance analgesia fear inhibitory. The role of neurotransmitter in the CNS and its disorder like Parkinson's disease. PD is neurodegenerative disorder primarily characterized by motor symptoms such as bradykinesia, rigidity, tremor, and postural instability. These dopaminergic events disrupt basal ganglia circuits that regulate voluntary movement, resulting in motor impairment. Dopamine replacement therapy with levodopa remain gold standard treatment, although long-term use is associated with motor functional by dyskinesias. Depression. Major depressive disorder has been linked to dysregulation of monoamine neurotransmitter, including serotonin, norepinephrine, and dopamine. The monoamine hypothesis posits is that reduced neurotransmitter level in the key brain region, such as prefrontal cortex and limbic structure, contribute to depression systems. Pharmacological treatment targeting serotonin and norepinephrine reuptake. Schizophrenia is a chronic and psychiatric disorder characterized by psychosis, cognitive deficiency, and negative symptoms. The dopamine hypothesis suggests hyperactivity of dopaminergic signaling in the metabolic pathway, contribute to positive symptoms, including hallucination, delusion symptoms. Epilepsy. Epilepsy involves in reoccurrent unprovoked seizures resulting from abdominal renal hyperexcitability and hypersynchronia. Imbalance between excitatory, which is glutamate, and excitatory GABA neurotransmitter contribute to seizure generation. In conclusion, Neurotransmitters are vital to the CNS, to the central nervous system function, communicating between neurons and regulating a myriad of physiological and physiological processes. They are the first role in cognition, motor control, emotion, and pain underscores their importance in maintaining neuro system is implicated in numerous nervous system disorder, emphasizing the needs of continued therapeutic approach. Promising promise for uncovering novel neurotransmitter targets, improving disease outcome, and enhancing the human understanding brain behavior. Thank you.